Okay, so now I'm back with the history of the disease, Clostridium tetani, known as tetanus. It is a category of bacteria you may have heard of, like the Clostridium difficile or C. diff. Clostridium tetani, or known as tetanus, lives in the gastrointestinal tract of humans and animals. It is found in the soil and in feces. Tetanus made its place in history during World War I because of the mass number of people who sustained open wounds and had no time to clean them, and had those wounds come into contact with things like soil, horse poop from the battlegrounds. A vaccine was created during World War I by the bacteriologist Emil von Behring and Cibosoburo Kitasato in 1890 to 1892. It proved to be effective in greatly reducing the number of the tetanus cases. Vaccination to prevent tetanus in the U.S. began in the late 1940s and was started in Texas. Texas has long been known for its success in agricultural and livestock events, and they needed a way to slow the amount of cases down. By not seeking medical attention and thinking the wound is not bad at all, like us most humans do, could result in some complications such as respiratory arrest, upper airway obstruction, fractures, cardiac arrhythmias, and hypertension, stress ulcers, coma, nerve damage, hypoxic injury, paralytic ileus, cranial nerve palsies, and many other major things. One major effect would be toxin tetanoplasmin, which produces the illness symptoms, stiffness in muscles, spasms of jaw muscles, and progression to violent, painful, and convulsion spasms. The syndrome in which facial muscles become paralyzed, also named as lockjaw. This condition is characterized by tightening of the facial muscles to create a grimace-like expression. Tetanospasm enters nerve cells and travels to the spinal cord to create the progression symptoms of tetanus. I would not classify just horse poop as a caution. I would consider urine as an enemy as well when working with livestock. So I would call this a true fact. The incubation period of tetanus is 3 to 21 days. Most will have symptoms by the 14th day of their infection. Physicians who act quickly with infected patients can administer an antitoxin, tetanus immunoglobulin, TIG or IVIG, and tetanus antitoxin to help fight the infection, but even with treatment, a small percentage of infected people, fewer than 100 persons in the United States, die of tetanus each year. As a preventative, children in the United States receive a tetanus vaccine about 2 months of age with 4 boosters until the age of 6. This vaccine does not give permanent immunity, so adults should receive a booster injection every 10 years. If a person has sustained a deep wound, tetanus prevention involves a thorough cleaning of the area with soap and water and followed by an antibiotic cream or ointment, then a sterile bandage covering, and should be changed daily. You should also get vaccinated. Very deep wounds in which dirt remains should be treated by a physician and may require a powerful medication, the TIG. Many adults are not educated about vaccine information and when they should really be receiving boosters from our vaccines into adulthood. Pregnant women are among this group. Pregnant women should not take the vaccine while pregnant, but if the woman has not had the vaccine in over 10 years after she's given birth, it is considered that they do so immediately after. I was someone who was not vaccinated enough time and had a child and did get vaccinated immediately after and was spoken to about so. Anyone can get tetanus, but the disease is particularly common and serious in newborn babies and pregnant women who have been significantly immunized with tetanus toxoid containing vaccines. Tetanus during pregnancy or within 6 weeks of the end of pregnancy is called maternal tetanus, and tetanus within the first 28 days of life is called neonatal tetanus. Just because you have been vaccinated does not mean that you're immune to the tetanus. By being vaccinated, you are at a lower risk of developing a severe case, but still would need a booster to remain effective.